8 positions that a new grad can qualify for, non-bedside or non-patient facing. Some of these you may get in with just under 1 year of bedside experience. So let's talk about it. I did another video where you don't need any experience and you can possibly get into these roles. A new grad is considered someone that has under 1 year by some hospitals. Some hospitals consider a new grad someone under 2 years, so just check to see what that meaning is. Number 1, primary care specialty outpatient clinic nurse. For this one, you'll be working in a doctor's office, which is family medicine, pediatrics, dermatology, cardiology type of office. And this involves direct patient care, but in a less acute type of form. And it's often more predictable in the tasks and the daily work than in a hospital. What will a new grad do? Well, they'll assist with the patient intake. Think of you going to your own doctor's appointments, taking vitals, medical history, administering vaccinations and medications, and also maybe giving some wound care depending on the clinic that you're working in, some patient education, of course, some phone triaging, and managing prescription refills. Why is this good for new grads? Because it offers a chance to still build a foundational assessment and build your foundational skills without taking you completely away from patients. And it gives you the chance to improve your patient interaction skills in a less high pressure environment such as acute care. And it has more regular hours if you're used to your 9 to 5 Monday through Friday with holidays off. School nurse. Number 2, school nurse. For this one, you'll be providing healthcare to students or managing their conditions and making sure they take their medications properly in an educational setting. For this one, as a new grad, you'll be administering first aid if needed, managing medications, maintaining student health records, conducting health screenings, and such as an eye exam, and providing health education. Some positions might involve more administrative tasks or assisting a lead school nurse. So why is this one good for new grads? Well, again, regular hours, typically school days, opportunities for health education and promotion, and a focus on a specific population. Some schools may hire new grads, believe it or not, especially if they have strong communication and organizational skills. You may consider this one sort of high pressure because you are responsible for that child. Number 3, ambulatory surgery clinic. This one requires caring for patients that are undergoing same-day surgeries, surgical procedures, but mainly won't require an overnight stay. As a new grad, you'll be responsible for the pre-op assessment, post-operative monitoring, administrating medications as needed, providing patient education, and assisting with discharge planning, and the roles can vary, pre-op versus post-op. Why is this one good for you as a new grad? Because it still gives you exposure to bedside nursing, but in a surgical sense or in a surgical environment without the intensity of inpatient hospital settings. You can develop your skills in patient assessment still, medication administration, and understanding surgical and expand your understanding of surgical procedure. Number 4, infusion nurse. In a clinic setting or also as a home health nurse, these are available. For this one, you'll be administering intravenous medications through an IV, antibiotics, chemotherapy, biologics to patients in an outpatient clinic. As a new grad, you will be assessing patients, of course, prior to the infusion and after the infusion, starting and monitoring IVs, administrating medications according to protocols, and managing potential reactions, as well as providing patient education still. Why is this one good for you? Because it develops specialized skills. So if you're bad at putting in those IVs, this will give you all the practice that you need and you will become a pro at it. IV therapy education for yourself and both to the patient, and medication administration in a more controlled environment than in the inpatient care setting. Corrections nurse. Number 5, corrections nurse. This one requires that you work at a prison or with inmates. For this one, you'll be providing healthcare to individuals in correctional facilities, so jails or prison, and new grads will be tasked with conducting health assessments, administering medications, treating acute and chronic illnesses of the inmates, and managing minor injuries that can happen, and assisting with medical emergencies. Why is this one good for you? Because it offers a unique patient population and the opportunity to develop strong assessment skills and problem-solving skills with a focus on a different set of healthcare challenges. So some facilities actively recruit new grads because in some areas there is no interest in this type of position, and in some areas there aren't a lot of nurses available in the area, as some prisons are kind of quarantined in the middle of nowhere. So just check your area, you might find a position for you. But I also hear they have very good pay for these types of positions, high pay for what you deal with. So just check your area. Number 6, flu shot or vaccination clinics. For this one, it sounds pretty clear-cut to me. Many organizations, such as pharmacies or companies or public health agencies, offer this position, and they hire nurses for temporary or part-time roles to administer vaccinations. The new grad will be tasked with administering intramuscular injections and subcutaneous injections as well, documenting the vaccinations, and managing any adverse reactions to the medication. Why is this one good for you? Because it's an excellent entry-level opportunity to gain experience with giving injections and patient interactions in a focused setting. This one often has flexible hours, and again, you might find a part-time gig. Number 7, home health nurse with structured mentoring, with structured onboarding and mentoring. So make sure if you're going to become a home health nurse, that particular position mentions that they have an onboarding program for new grad nurses. For this one, you're providing nursing care in the setting of a patient's home. You'll be observing and reporting patient statuses, assisting with basic care needs, fulfilling the orders of the doctor, medication administration, wound care under supervision. Agencies with strong new graduate programs may pair new nurses with experienced mentors for their preceptor. Why is this one good for you? Because it offers autonomy and the chance to work closely with patients still and their families. However, it requires strong assessment and time management skills. So look for agencies with a robust support for new nurses. If you're looking at some of these reviews for some of these home health agencies, make sure that you're looking to see if they offer great new grad support. Number 8, medical assistant or nurse extender roles. What this is so in some clinics or healthcare systems, they have roles that kind of bridge the gap between a medical assistant and a registered nurse. This often involves a higher level of clinical responsibility than a traditional medical assistant or MA, but under the supervision of an RN or a provider. As a new grad nurse, your tasks would basically vary depending on the setting, but it may include more advanced assessment skills, assisting with procedures, and also patient education. So why can it be good for you as a new grad nurse? It provides an opportunity to utilize nursing skills in an outpatient setting while receiving guidance and experience as well. So some strategies to consider as for these non-bedside roles: network. Reach out to nurses working in these settings already and see if you can get an informational interview with them to kind of get some insight into what you're getting into. Highlight your transferable skills when you're working on those resumes and when you're doing the interview process. Emphasize your communication, your organizational skills, your critical thinking, and your assessment skills. And make sure that you are strong in these areas. Be open to different settings. Consider various outpatient clinics and schools and community health organizations during your job search. look for new grad programs. Some organizations are starting to offer non-bedside specific new graduate programs, so make sure that you take advantage of these, because these tend to offer more support for you where you are at in your stage of your career as a nurse. Gain foundational skills. Gain those foundational skills. Even if your long-term goal is non-bedside, being open to a short period of bedside nursing can provide valuable experience that can make you a strong candidate later. So don't think that it's totally over for you if you just have under 1 year of experience. If you don't like bedside, make that transition, but make sure that you gain those foundational skills before leaving bedside. Hopefully this video was helpful to you. Please like, subscribe, do all the things. And if you need help with those interview skills, try watching this video right here. See you in the next one. Bye.